Tajikistan is a country of high mountains and beautiful valleys, a country with rich history and strong cultural background, with open-hearted and hospitable people. Being landlocked, more than 60% of the population lives in rural, remote areas where access to quality healthcare services is limited.
The AKDN eHeath program in Tajikistan, initiated in 2013. The program offers live teleconsultation, teleradiology, and e-learning services to remote populations. In the past few years, I have witnessed many success stories.
Amin Jamshed, a 7-year-old child, was brought in an ambulance to the emergency department of the Korogoblast General Hospital in a terrible condition.
He was breathing heavily and his hands and legs were immovable when he came to the hospital.
Jamshed is a very healthy child. He hadn't ever taken antibiotics in his life. That Sunday, he woke up crying, unable to describe his pain. Suddenly, his arms became limp. We would pick up his arm and it would just fall back down. A little, he complained about not being able to pass urine and his legs started to become limp as well.
The community healthcare professional could not diagnose him either. He could hear, talk, and respond. The only problem was his arms and legs were paralyzed. He was rushed to the Korogoblast General Hospital, which is 45 minutes away from the village.
After checkup, we diagnosed Jamshed with bipolar neuropathy. Because I'm the only pediatric neurologist in the Oblast region, we decided to arrange the teleconsultation for accurate diagnosis with the French Medical Institute for Children, which specializes in child care. Dr. Ismatullah Hamid, a pediatric neurologist at FMIC, was consulted for a second opinion. He concluded that the patient had widespread myelitis, a rare disease, a result of the immunization.
I had lost all hope and thought I may never see my son ever again. But after having the teleconsultation with FMIC, we felt so relieved. The physician at FMIC was kind and spoke to us in such a nice way that my son's mood improved and he even smiled. On the third day of the treatment, we could see some improvement in his health.
Teleconsultations help people like Jamshed's family receive quality care by visiting health centers nearby, saving travel time and reducing costs.
My son is recovering now. My happiness had no limits. God is great. I am happy that we were able to consult another doctor through teleconsultation. When I was crying, they gave me hope. After the teleconsultation, I felt like my son had been given a new life. My son may start walking soon.
The AKDN eHeath program, funded by Global Affairs Canada and the AKDN Foundation Canada, with the support of the Ministry of Health, Tajikistan, has achieved over 3,500 teleconsultations and has trained over 2,000 e-learning participants between November 2012 and March 2017. This has been made possible through public-private partnerships with 7 government-owned facilities.
This is kind of vital for Tajikistan because 80% of Tajikistan is mountains and more than 60% of population is living in the remote areas. So having eHeath is vital in terms of having access to health care. Okay, so in terms of being efficient also, like in terms of efficiency and time efficiency, it's very important to have eHealth services for this population. And in terms of quality of care also, to have access to quality of care, eHealth is very important component in Tajikistan.
Thanks to the AKDN program, such services are provided in the remote areas. We would suggest that they expand the program to run not only in these areas but other unreachable marginalized areas like Bhartang, Margoob, Chowdhury in Vanj district.